Transition for us is the process whereby we support our children and young people through the process of growing up with a long-term condition and moving from a children's service through into the young adult service. So I work in the children and young people service, where we look after children and young people up to from the age of 0 to 19 years. We think about transition from the move into high school at the age of 11 and through up to 16 years, and we then have a young people's clinic that we look after young people from the age of 16 to 19, with then the support of the young adult service, which is then based at Manny Cousin Centre, who look after young adults up to the age of 25. So for our children and young people, we use the Ready Steady Go programme to help us to focus on their skills and knowledge that they have at that particular time, and looking forward to the skills and knowledge that they will need ultimately to be able to self-manage their diabetes. Obviously our young people initially at diagnosis, the education, especially if they were diagnosed at a young age, would be very much directed at the parents, and we are very keen to have a very gradual process of supporting young people to gradually, as they feel ready to, take on more responsibility for managing their condition independently, with at the same time also supporting families to help young people to gain their independence.
My role within transition is to help support young people who are going from the process of going from paediatric to the adult or to the young adult clinic. In diabetes, my role is to support young people through tools like the Ready Steady Go, which is a transition care plan, and it's to support young people through this stage, because it can be quite difficult and sometimes quite unnerving for young people when they're going from a team that they know really well to a team that they don't know so well. So extra support is just there to help these young people get the most out of the new team. So the Ready Steady Go care plan that we use helps us talk to young people about various issues. So some of it might be social and emotional issues. Some of it will be about knowledge about their condition, how they manage their condition. Some of it goes into things about how they're managing at school or college, what their career plans for the future are. It asks some questions about things like sexual health and drugs and alcohol and things like that. So we just really use it as a tool to have a discussion with young people that covers every aspect of their life, rather than just focusing on their health.
So as part of our transition process, we offer young people the opportunity to come into clinic by themselves initially if they feel ready to do so. We find this really useful in helping young people to learn how to interact with us as independent young people. And it can also give us the opportunity to perhaps discuss things that young people may not be very comfortable to talk about in front of their parents. At the same time, they can bring their parents in at any point that they feel it would be helpful, and we often ask them to then reiterate to their parents what we've just talked about, helping them to learn how to retain the information that we discuss in clinic and put it into practice when they do go home.
In the diabetes transition clinic, we have a young adult doctor who comes across and meets young people from the age of 18 for a year up until they transfer at the age of 19. Alongside this, we also can organise an orientation visit to the young adult clinic, so that young people can go down and see who the new nurses are, like explore the new surroundings and where they're going to be going for the clinics, and meet the team down there. And also, as part of my role as a youth worker, I can go down with young people for however many appointments they might need me for, to help them feel settled down there, and just make sure that the transition from paediatric to adult healthcare is as seamless as possible.
Hi, I'm Julie. I'm one of the diabetes dietitians, and I'm part of the young adult team. If you're coming from the children's diabetes service, you may not see much difference in the team. There's still a dietitian, there's still a diabetes nurse, there's still the doctors. The role of the dietitian is to help you with any questions or queries that you've got about anything to do with food, eating out, takeaways, alcohol, exercise, and any questions that you might have about special diets, for example if you've got celiac disease and diabetes. But it's just to let you know that I'm here if you've got any questions at all about anything to do with food. Please, come and see me, pop in.
Transition is difficult with a long-term condition, as you have young people who are growing up with all of the pressures and stresses that young people have in general, with the added complication of having a long-term condition. We look after young people from the time of diagnosis, and they get very used to our service, and it can be quite stressful for them to think about having to move service into an adult setting. Our aim as a team is to try and support all of our young people so that they feel confident and have the knowledge and skills to be able to manage their diabetes in our case, and to feel confident in their abilities to then move forward into the young adult service, managing their condition really well.
Hi, I'm Claire, one of the diabetes nurse specialists, and my main speciality is dealing with young people's diabetes. So I look after the patients 19 to 25-year-olds with diabetes. So when you first come from the Children's Diabetes Clinic up to the Manny Cousins Centre, you'll come in to our centre in the Beckett wing. I've been dealing with young adults for the past sort of 18 years whilst I've been specialising in diabetes, and I think the biggest thing that people tell me is that they don't want to be different. So it's about if they're going out with the friends and they're going out maybe to McDonald's or Subway, or they're maybe going out drinking, that they have to think about what they're eating and inject, and they don't really always like injecting in front of the friends. So I think it's just that young adults don't like being different. So we just try and make it as easy as possible. We run a Daphne course, which isn't specifically for young adults, but it's for anybody with type 1 diabetes, and it's about trying to normalise diabetes wherever possible. So we can't make your diabetes go away miraculously. I wish we could. But we can try and make it as easy as possible and try and make it easy to fit in with your life, be it sports, drinking, going to festivals. We're very open-minded. We don't make any judgment.